It's not something we're used to, but our government encourages us to wear homemade masks when we're out in public. Because the coronavirus spreads through droplets, when an infected person sneezes, coughs, or even talks. Medical professionals who work with sick people every day are at a higher risk of infection than you or me. Right now, there's a worldwide shortage of medical grade masks. We need to save those types of masks for the doctors and nurses who need them the most. Homemade masks are not medical devices. They won't necessarily prevent the person wearing them from being infected, but they do have some ability to prevent the person wearing them from infecting other people. Masks also stop you from touching your face, which we do more often than we think, and is one of the ways that infection can occur. Homemade masks won't protect you fully, but they will offer another measure of prevention. The most important thing to remember is that masks will only work if they're used in combination with social distancing and washing our hands regularly. When you're in public, wear your mask. Stay 6 feet away from people at all times. Don't touch your face, and wash your hands frequently. By practicing all of these measures, together, we can protect our community. For more tips and advice, please visit www.gov.ky/coronavirus.
I'm Mona Lisa Mead, and much like you, I'm finding it hard to navigate this new normal by wearing a mask and keeping it clean. We know that COVID-19 can survive on certain surfaces for a long while. So before you put your mask on, please do not contaminate it by placing it on an unclean surface. And when you return home from being out in a public space, just wash your mask like you would any load of laundry. By using hot water, you can help destroy any traces of the virus before you use it again. And remember, sharing a mask means you may be sharing the virus. The most important thing to keep in mind is that masks only work in combination with measures we already have in place, like social distancing and proper hand washing hygiene. By practicing all of these measures together, we can protect our community. For more tips and advice, visit www.gov.ky/coronavirus.
Hi, I'm Jade Parker. We understand that our government's new requirements to wear a homemade mask out into public spaces will be an adjustment for most of us. It's not something that we do every day. A homemade mask can help to prevent the spread of COVID-19 if worn correctly. Here are some tips to help make it easier. Masks should fit snugly but comfortably against the side of your face and be secured with ties or ear loops. You should be able to breathe through your mask, although you may find it a little hot because of your own warm breath. Keep the mask secured over your nose and mouth. Your nose should be fully covered. If it isn't, then your mask will not protect you. Avoid touching the front of the mask because this is where any contagious droplets may have landed. Instead, when taking the mask off and on or adjusting it, only touch the elasticated strings or the string around the top of your head. When removing the mask, put it on a clean surface that you will later disinfect. As an example, don't put the used mask on your kitchen counter while you wash and clean your groceries. For more tips and advice, please visit www.gov.ky/coronavirus.
Hi, I'm Khadija Baden, Miss Cayman Islands Universe. And I know everyone is talking about masks. It's not something we're used to, but our government encourages us to wear homemade masks when we're out in public. Because the coronavirus spreads through droplets when an infected person sneezes, coughs, or even talks. Medical professionals who work with sick people every day are at a higher risk of infection than you or me. Right now, there's a worldwide shortage of medical grade masks. We need to save those types of masks for the doctors and nurses who need them the most. Homemade masks are not medical devices. They won't necessarily prevent the person wearing them from being infected, but they do have some ability to prevent the person wearing them from infecting other people. Masks also stop you from touching your face, which we do more often than we think, and is one of the ways that infection can occur. Homemade masks won't protect you fully, but they will offer another measure of prevention. The most important thing to remember is that masks will only work if they're used in combination with social distancing and washing our hands regularly. When you're in public, wear your mask. Stay 6 feet away from people at all times. Don't touch your face, and wash your hands frequently. By practicing all of these measures, together we can protect our community. For more tips and advice, please visit www.gov.ky/coronavirus.
Good afternoon, everyone. I'm Donna Bush with today's coronavirus press briefing. Thank you for joining us via our channels as well as Radio Cayman. We go first to Pastor Kathy Ebanks.
Good afternoon, everyone. I'm Pastor Kathy Ebanks, the Executive Pastor of Agape Family Worship Center and a member of the Cayman Ministers Association. Let's pray. Father, we come boldly before you today in praise and thanksgiving. We thank you for your goodness. You are holy, true, and pure in all your ways. There is none like you. You are our rock and our salvation. We thank you for blessing us with another day. We ask you for your peace, your presence, and your comfort in the midst of the struggles that we are facing as a nation. As 1 Peter 5, 6, and 7 says, we humble ourselves today under your mighty hand and cast all our cares on you because you love and care for us. We give you thanks today, Father, for the leadership of our governor, premier, minister of health, the elected members of cabinet, the opposition, and for all our leaders. We ask for you to grant them your wisdom, knowledge, and discernment as they continue to lead the Cayman Islands during this time. Guide and strengthen them and let your divine peace and blessings be on us all. We honor you and give you praise, for you are the true and living God who has the power to do the impossible. We ask for miracles in this crisis and revival in all our hearts. Bless and protect us today, that our government, our islands, our families, and loved ones would be an example to the entire world of your goodness, grace, and mercy. Deliver us from all evil, and we pray these things in the mighty name of Jesus. Amen.
And thank you, Pastor Kathy Ebanks. We now welcome our panelists, His Excellency the Governor, the Honourable Premier, as well as the Honourable Minister of Health. With us in studio are the Medical Officer of Health, as well as the HMCI Director and the Sign Language Interpreter, Ms. Carolyn Powell. We first call on the Medical Officer of Health, and we'd also like to welcome, of course, our members from the media. Dr. Williams Rodriguez, please.
Hi, good afternoon. So we have some results to report today. We're going to start by giving since the last press release, we have 3 positive results. One is a contact of a known positive patient, and the patient is asymptomatic. The other 2 are part of an ongoing investigation, and they're both asymptomatic. We have a total of 764 results received by press time. 620 were processed at the HSA, 144 were processed at Doctor Hospital. These are a mix of screening results from different sectors of the population and also public health testing for follow-ups. So we have 761 negative results. To date, the total of positive results is 84. We don't have no patient currently admitted associated with COVID-19. 47 have recovered. We have 8 active patients, and of course, 1 death that we all know, the first patient. The flu clinic continue to see numbers like in Friday we saw 10 patients, 5 on Saturday, 2 on Sunday. The flu hotline continue also to be pretty much around the same, 23 calls on Friday, 23 on Saturday, and 10 on Sunday. At the government isolation facilities, we have 94 individuals, and individuals in isolation under public health, we have 98. To date, we have a total of 4,188 cases that have been tested and resulted here in the Cayman Islands. I want to take a minute to address the situation with one of our supermarkets that have been in the media. And we want to say that the management of the supermarket have been in close communication with public health. And up to now, we have 121 cases resulted. And a very low percentage of these cases are positive. By the end of tomorrow, we are planning to test the rest of everyone in the supermarket. All contacts have been tested, have been done by the HSA. As it was announced in the media and by the supermarket itself, deep cleaning was executed at the supermarket, also supervised by the Department of Environmental Health. And also the HSA and the doctor hospital will continue to do the screening for the rest of the staff. So with that, if there's any question.
Okay, thank you, Dr. Williams Rodriguez. We do have some questions from members of the media. We're going first to April Cummings at Radio Cayman.
Hi, Dr. Rodriguez. Two questions. One is sort of general. Should people who've been shopping at the grocery store be concerned? Should they do anything different? And the second is, could you talk a little bit about the expanded testing at HSA?
Okay, so the first question, the person who have been shopping in the supermarket shouldn't be concerned if they have been following the advice that we have been giving everyone during these days, basically to keep social distance, to make sure hand hygiene and cough etiquette. When they get home, make sure that they don't touch, they don't touch their face before they can clean or desanitize their hands. So we all have said many times that the main transmission of this virus is by droplets. So it's not by touching food or by touching any superficie. So it's important, hand hygiene is very important and need to be continued not only in any particular place, but all around the Cayman Island. To your second question about enhanced testing, the HSA, because of the country, is enhancing testing. We have actually dedicated 2 areas drive-through for screening, but not all, and we have seen screening over 300 patients per day. But not only that, HSA is also going to organizations, to big companies, screening there as well. And that will continue until we complete this exercise.
So one of the questions that came to me from the public is, as they're hearing about this testing, some of them do want to be tested voluntarily. I understand that that's not what the plan is necessarily at this stage, but can you speak a little bit to that?
Yeah, definitely the plan at this stage is not to test randomly the whole island. We are focusing in the person who actually have bigger interaction with the public and to try to open up some sector of the economy as well. So all those frontline testers in the healthcare sector and other sectors as well, the supermarkets, pharmacies, anyone, the group that is already out there, those are the ones that we're focusing testing right now. As you all know, we also have increment testing in the sister island. And those are the main group that we are testing right now. We will start testing other groups in order to start allowing them to get into the economy, into the regular hours.
Thank you very much, sir. I appreciate it.
Here we go next to Wendy from CNS. Wendy, please go ahead.
Thank you, Donna. Hello, Dr. Williams. Just a couple of questions. At this point, can you tell us whether the prison has been completed and whether anyone tested positive at the prison?
The prison has not been completed. Most, if not all, of the prison officers have been completed, and also a percentage of the prisoners. None of the prisoners, neither of the prison officers have tested positive at this time.
So none so far?
No.
Okay. Just to clarify, those numbers that you gave earlier, of the 3, 2 of them were the ones from the supermarket?
They are for ongoing investigations, yes.
Okay, great. Also, one of the questions that keeps coming up a lot now amongst the public is there actually a target for testing, like a lot of countries have got daily targets or weekly targets. Have we set one at the HSA yet, like a target that you're aiming for and trying to get at?
We're trying between the HSA and the other facilities that are assisting the HSA, like doctor hospitals and Health City Cayman Island. Our target is to do at least carry between 400 and 450 tests daily.
But when do you think we'll be there?
We should be there now. We're starting that. As you noted, the report over the weekend, we have over 760 results.
So you would expect now each day for at least 400 results to be given out each time yourself or Dr. Lee comes?
We're expecting to collect that amount of sample and to process them. As long as there's no issue with our labs or any of the lab or any of the machine, we will expect to report close to that amount of cases daily.
Okay, great. That's all my questions. Thank you.
Okay, thank you very much, Wendy. We now go to Kayla from the Compass.
Hi, Dr. Williams. Earlier, it had been reported that there were 2 frontline staff who had tested positive. Can we get an update of the total number of frontline staff now that we know to have been tested positive following this confirmation of staff at Kirk Market?
I can get that exact number for you, the total of frontline staff. I don't have the exact number now, but the number has been very, very low. I can assure you that.
Perfect. And would it be possible to provide those numbers by sector so that the public might know which types of frontline workers are being most impacted currently?
We will discuss that, and if it's possible, we will provide that information to you.
Okay, thank you. That's all for me.
Okay, we go now to Ralph from the Caymanian Times. Ralph, please go ahead.
Good afternoon, Doctor. Just one question regarding another area in testing. If a traveler was to arrive at the island and was tested immediately, how long would they have to stay in quarantine, and if so, why?
So persons who arrive here into the island need to remain in quarantine, must remain in quarantine for 14 days, and they will be tested after the 14 days. If they test negative, they will be allowed to go. The reason we are implementing this is because somebody could be incubating the virus yet and test negative, and then if we allow them to go release them into the public, that there is a risk in there. So that's why we have this 14 days in mandatory isolation for anyone who reached the Cayman Island, and then they will be tested at the end of it.
Thank you.
Okay, Ralph, if that's it for you, we're going to go back to Kayla from The Compass. Kayla, please go ahead. I'm not hearing you. No further questions right now?
Sorry, my questions are for the panel.
Oh, okay. All right. We'll come back to you then. I do have a question for Dr. Williams Rodriguez. The tracing guidelines, what kind of guidelines are we following here in Cayman? Are they UK guidelines or are they US guidelines? Whose guidelines are we following as far as tracing, contact tracing?
Well, contact tracing is actually international standard guideline, and basically anyone who consider a close contact with a person will be traced. And those are all household members or anyone in an enclosed work area that have been in a proximity of 1 meter or less during an extended period of time, usually 15 minutes or more.
Okay. Another question on the tail end of that question. Just give us a scenario, if you can, of what that looks like as far as numbers are concerned, because people may think, oh, you just test a couple of people in the household, a couple of people in the job. In some countries, they're testing or tracing up to like 25 to 50 people. What does that look like for us here in Cayman? Here,
normally, when we do contact tracing with any individual, and it's all depend on the household and the members, but usually will be anything between 15 to 25 cases that we screen. The last one we had done was 27 persons, so it will vary, but definitely usually more than 15 persons.
Okay. All right. Thank you very much, Dr. Williams Rodriguez. We're going to go now to the panel, beginning with our Honorable Premier.
Thank you, Donna. Hello, everyone. The results over the weekend, I think, are very, very encouraging. That many negatives is something that is very positive. But I think we also need to bear in mind that there are 3 positive results, 2 of which are frontline staff. And that underlines the importance of the exercise that we are carrying out in trying to test as many of the frontline staff, the people who are exposed on a daily basis to a number of other people. Most of these individuals are asymptomatic. Again, something that should give us pause when we agitate, as so many people are, for a swift release of all of the current restrictions and the complete reopening of the economy. The testing has always been a key component of the government's strategy to be able to reopen the economy safely. And we are doing everything we can to ramp up the ability of the systems to be able to deliver more results. We are aiming for significantly more than the 450 that Dr. Williams Rodriguez spoke about. but there are some capacity issues and some equipment issues that we need to address to be able to significantly increase that number, utilizing places like HCCI as well. So, as Dr. Williams said, the HSA has expanded their testing capacity with the opening of 2 drive-through screening tents for frontline workers and expansion of the laboratory to increase the processing samples in a day. Upon arrival at HSA's drive-through screening area, the whole process takes approximately 5 minutes. HSA has also expanded physical laboratory space at the Cayman Islands Hospital, partnered with a private lab, and has hired and trained additional laboratory staff in order to increase testing capacity. So we are working very hard on that particular front. Now, we released some 6,000 workers back into the workforce, into circulation last week. And so, following the protocols that have been recommended by WHO, we are waiting 2 weeks before we release another significant sector of the economy and put more people back, even more people back into circulation. So we've gone through 1 week of that now, so we go through this week. And the objective of doing it in that way is to be able to see what impact the release of additional people into the workforce and into circulation generally will have on the profile of the virus in the community. We should be able to see during the course of this week if there are any symptomatic cases that pop up. Obviously, the asymptomatic ones continue to be a cause for concern in the sense that you don't necessarily know if someone has it or not, if they're not displaying symptoms. But given the sheer number of people that have been released, we would expect that there would be some sick people if they do have the virus who start to show symptoms and come in for attention. The next sector of the economy that we are looking to release, we've talked about this before, involves construction and development and the reopening of the Home Depots and hardware stores and those sorts of places where people will be able to actually go inside an enclosed space. Obviously, the risks involved in that are significantly greater. And hence the reason why we haven't opened those to start with. The areas that we opened over the course of the last week were areas where it is a delivery of a service or a delivery of a product where you don't necessarily have to interact with the customer on a face-to-face basis. The next step, obviously, will start putting people back in contact with each other, even when you try to observe the physical distancing protocols, which have now become almost second nature, I think, for most of us. So it does significantly increase the risk. And therefore, with some 8,000 people in that sort of construction development sector, it is not going to be possible to simply release that entire sector in one fell swoop without running immense risks. And so that is going to have to be staged in the sense that we are working and will shortly announce a plan of how we'll go about the testing exercise for the construction industry. As far as the Home Depots and so forth are concerned, that is much easier. We can probably test most of their staff fairly swiftly. But we're not going to be able to test everybody in the construction and development industry. So therefore, we have to take a different approach to that. Small companies, construction companies that have, say, 10 employees, relatively easy to test all of your guys and you're okay. But if you've got 90 or 150 people and you got subs, it's not going to be possible in the time that we have to be able to test everyone. So we're going to have to try to do representative sampling of the bigger companies. And we're going to have to stage the reopening in the sense that certain companies will be allowed to open, having met the protocols and having had the testing done, while others will come along in the queue and get open when they have been essentially signed off. I should say that I've spoken to the Medical Office of Health just this afternoon, and it is going to be critical that construction companies understand that they will be subject to public health inspections to ensure that they are carrying out the proper protocols, that their workers are wearing masks, that there are proper sanitation facilities to wash your hands, that there's proper provision for how workers are able to get food and to eat, to try to minimize the risks as we go forward. So I know, because I've received I don't know how many messages, that many people are anxious to go, and we got such low numbers, they say, in terms of positives, that we can just reopen the entire Cayman and we'll be back to business as usual. The lawyers are absolutely the worst. I mean, I just don't know. I think Shakespeare was right. But I'm glad I'm not a lawyer anymore. But the reality is, we would be going against everything that has been written about and everything that we are witnessing as to what happens when you simply just open the doors without further consideration. Even places like South Korea, that have been very careful, are now back in a situation where they're chasing the virus again. Wuhan, just watch for the meltdown in the United States. So watch what's going to happen in the United Kingdom, I'm afraid, because of the pressures that are being brought to bear there. We cannot safely reopen the economy until we are certain that there aren't significant numbers of clusters of cases around. All of the signs in Cayman are very good. Our population is small. We've closed the borders. If we are patient a bit longer, and if we follow the proper protocols, we can, I am certain, get to a position relatively soon where all of us can move around with real confidence that the virus is unlikely to be in the person that is talking to you now, standing next to you, serving you in the store. We'll be able to, as I've said before, reopen restaurants, particularly those that are able to serve on the terrace or outside, and even perhaps open some of the bars that are open air outside relatively soon. But if we simply yield to pressure and to the demands that we are receiving to just reopen everything now, I don't know why anyone can believe that it's going to be any different in Grand Cayman than it is anywhere else in the world. The virus is going to come back, and it's going to come back with a vengeance, with the result that we either have a complete and utter shutdown of everything again, or we let the virus have its way and take out as many people as it takes out, which is generally the approach that the United States seems to be adopting. As I've said before, I'm not going to go back on on the pulpit again about what I believe the ethos of this country is with respect to human life and the value we place on it. I'm just urging people to be patient. The strategy is working. And if we see it through for another few weeks, I believe we'll come out on the other end very successful. If we, at this stage, give in to the demands and just reopen the economy, I fear we're going to spend the next 6 months in what my father used to call snoring hell.
Thank you, Premier McLaughlin. Your Excellency.
Yes, good afternoon. Thank you very much. I mean, just two comments to add to that, and I agree with everything the Premier has just said. I mean, I know people will be concerned about the outbreak at Kirk's, but I think actually Kirk's handled it extremely competently and efficiently, and we are only talking about a very small number of people, and this is what our frontline testing is for. It's exactly for this purpose. So we will get cases popping up from time to time, but we can then isolate them, track them and trace them and suppress any wider spread. So I continue to believe as well that our broader strategy is on track, and we will be able to carefully and sensibly and in a measured way open up more as we move through our suppression levels, moving next to level 3. And there's a lot of work going on behind the scenes on that now. Secondly, just on testing, and I do understand that people are impatient to have lots more testing, but we should just recall as well that our system is very robust. We can be 100% certain that it is accurate. And a lot of the rapid tests that are being used in the US only have an 85% success rate, but we know our system is robust. And if you also look at Cayman's statistics, tests per head of population, we are also way up there. I mean, the back of the envelope calculation before I came here today, we're in the top 15 in the world for the amount of testing that we're doing. So yes, we want to do more, and I know people are working very hard to enable us to do more, but I do think we need to keep it in perspective. On evacuation flights, just one announcement today. There are still a small number of seats available on the flight to Santo Domingo, Dominican Republic, on Sunday, the 17th of May. Call Cayman Airways direct to book on those, 949-2311, or the Cayman Airways website. There's a lot of discussion going on behind the scenes about different evacuation flights, but there's nothing further to announce today. I just want to make a brief point about vaccines, because this is clearly absolutely crucial to the longer-term solution to this. And I do want to highlight the UK's leading role in trying to find a vaccine for COVID. The UK is one of the biggest donors, £744 million to the Global Alliance for Vaccines and Immunisation, known as Gavi. And the UK, on the 4th and 5th of June, will be hosting a virtual global vaccine summit, bringing together countries and organisations to follow the UK's lead in investing in the work of Gavi. So I do think it's important just to be aware of that. And then finally today, a shout out to Andy Bonner and our internal audit team in the civil service. May is International Internal Audit Awareness Month. And I think Andy's and his team are a perfect example of how the civil service have really stepped up in this crisis, reprioritising, working flexibly, because Andy's team, in addition to their audit work, have also worked on at our isolation facilities. They've worked on the curfew time team. They've also been supporting the business grant and loans application project, and they've also supported NEOC. So I think they've really shown exactly what it means to step up and deliver for everyone across the islands in this crisis. So thank you to Andy and your team. Thank you.
Okay, thank you, Your Excellency. We go now to the Minister of Health.
Thank you, Donna. Good afternoon, everyone, in Grand Cayman, Cayman Brac, and Little Cayman, and our Caymanian diaspora listening in. We say thank you again to everyone that has abided by all the measures and did their best to stay safe. Yes, there are rumors about COVID-19 not being real, just a fallacy. And I know we want to get back to normal quickly. And most believe, and I do, the government is doing a great job. And we thank you for your confidence in us. Unfortunately, there are some that wouldn't say that, and we know that that's how the world runs. Until they get sick from this coronavirus, then it's a different story. I say to you, to the public, take everything serious. Don't just let false news and rumors and international websites deter you from really understanding that COVID-19 is actually here. It's here. And you heard the premier of the pressure we're under about opening up to all. Every one of us, every minister, every elected person is under that pressure from someone who doesn't really care about human lives and who doesn't have a grandmother that is 100 years old and who doesn't have a mother who's vulnerable. So there are some selfish people in this world, and I can tell you that although we are thankful that the measures we took so early back in March 22nd has been a good result. And also our prayers, our prayer warriors, we can't discount how important that is in the position that this country has found itself in. And I want to say to you, yes, maybe some of it is true that we're seeing overseas, but still it remains that it's here. And we still need to be careful. We still need to do whatever we can to stay safe and stay available for our families. Today's scripture is from Psalm 6. 6. Go to the ant, you sluggard. Consider its ways and be wise. It has no commander, no overseer or ruler, yet it stores its provisions in summer and gathers its food at harvest. How long will you lie there, you sluggard? When will you get up from your sleep? A little slumber, a little folding of the hands to rest, and poverty will come on you like a thief, and scarcity like an armed man. A troublemaker and a villain who goes about with a corrupt mouth, who winks maliciously with his eye, signals with his feet, and motions with his fingers, who plots evil with deceit in his heart. He always stirs up conflict. Therefore, disaster will overtake him in an instant. He will suddenly be destroyed without remedy. There are 6 things the Lord hates. 7 are detestable to him: haughty eyes, a lying tongue, hands that shed innocent blood, a heart that devises wicked schemes, feet that are quick to rush into evil, a false witness who pours out lies, and a person who stirs up conflict in the community. Lord, add a blessing to the reading of his holy word. Shout out today to Popeyes and Burger King. Provided food to the HSA staff in Grand Cayman. I thank you very much. Shout out to Star Island. Provided food for the Faith Hospital staff in Cayman Brac. We thank you for that. We can agree that the COVID-19 pandemic has been a learning experience for us all, especially those who are blessed within the government. We've had to learn to adapt quickly as information develops while creating the appropriate contingency plans for our country. Amongst these plans is the field hospital that would accommodate any overflow of COVID-19 patients should our healthcare facilities reach capacity. On Friday, members of the National Emergency Operations Committee, or NEOC, leaders from the HSA and our clinicians toured the facility, the Family Life Center, Alternative Medical Center. This 60-bed facility has been fully equipped to house patients in the event of a resurgence of COVID-19 cases. While we do sincerely hope and pray that we will not have many persons requiring hospitalization, Preparing for such a scenario is important for saving lives. A field hospital was identified as a Phase 4 measure in the Cayman Islands clinical guidance for COVID-19 management. Several facilities were assessed and the Family Life Center proved to be the best solution based on size, adequate airflow, and proximity to the Cayman Islands Hospital. If necessary, the facility would require 120 staff members, both clinical and non-clinical, to operate at full capacity. The Family Life Alternative Medical Center will be managed by Dr. Delroy Jefferson, HSA Medical Director, Dr. Elizabeth McLaughlin, HSA Head of Accident and Emergency, and Jillian Barlow, HSA Nurse Manager. The Family Life Alternative Medical Center has been made possible through the public and private sector partnership. Special recognition goes to Mr. Simon Griffiths of the Public Works Department, who managed the project and worked closely with the HSA Clinical Task Force, NEOC, specifically Graham Jackson, NEOC project manager, and private health care providers to ensure all the necessary medical requirements would be met. We'd also like to express gratitude to Pastor Alison Ebanks and his Church of God congregation for providing the Family Life Center. I pray to God that we will never need it. I thank you and God bless.
Thank you, Minister of Health. Go straight to Kayla from The Compass. Kayla, please go ahead.
Hi, thank you, Donna. All right, my first question is for the Minister of Health. I understand that there have been discussions this week about updating the telemedicine codes and allowing for perhaps more open options for patients and practitioners. Do you have an update that you're able to provide about those discussions?
Yes, thank you very much, Kayla. Those discussions are ongoing. I just had a meeting with the chief officer and Mr. Merv Connolly, and they have got to a point now where they've actually developed a cabinet paper, which, in all good intentions, it should be looked at tomorrow, if allowed, at caucus. For taking this telemedicine initiative forward.
Great, thank you for that. We also saw earlier, this next question is directed at both the health minister and the premier. We saw earlier on Twitter that the governor was tested for COVID and is thankfully negative. Is testing also underway for cabinet staff and for the Ministry of Health?
Not yet.
I've been trying to get tested now a month, but it seems that I won't get sick, so they won't test me. But I'm glad and happy to know that I sit right next to the governor every day, and he's well. So I think I'm well.
And there is some testing going on in the building of persons
Yes.
in the building and civil servants.
I'm waiting for my turn.
Yes.
Okay. Is there any plan then to start testing of ministry staff or with the premier of cabinet staff?
We'll wait our turn. They are quite frankly, in my view, they are far more urgent demands on the limited testing capacity of the system than our people. Most of my cabinet ministers have been in isolation, self-imposed isolation. We meet generally by Zoom. There are only, myself included, there are only 3 ministers that come to the building at all. And I'm more than happy to do the test. All of us are, but we're not a priority at this stage.
Okay. Thank you for that. And Premier, you may have been hinting at this earlier with your comments about lawyers, about some of the comments made today regarding the hard curfew and Sunday lockdown measures and providing more transparency to the reasoning behind those measures. Could you provide us some more insight on that, and if there are any plans to publish the written details of the hard curfew measures, and if you believe that the response is proportionate to the public health demand to continue the hard lockdown on Sundays and the ban on marine activity?
The reason for everything we've done and are still doing is saving lives. Saving of lives is not a priority to everyone. I have email after email, message after message, in which people have actually said, some of them lawyers, so what if a few hundred old and vulnerable people die? I've explained that is not the ethos of the government. All of the measures that we've put in place have been aimed at saving lives, and still are. Now, obviously the results that we are having are indicating that we have succeeded in keeping the virus so far from running rampant through this society and killing off hundreds of our people. And so we're going through a measured process of rolling back those restrictions based on the advice we are receiving from WHO, PAHO, Public Health England, and our own public health people here. All of that advice is that it is hugely dangerous and will almost inevitably result in a resurgence of the virus if we simply lift all of the restrictions all at once and have people come back together as they were able to do before the advent of this pandemic. So last Monday, we lifted a significant amount of restrictions on the country as a whole. We have since released Little Cayman and partially released Cayman Brac. In fact, Cayman Brac has very few restrictions now, except the continued requirements for people to conduct themselves in a way in accordance with the protocols that have been developed to limit the spread of the virus. But otherwise, except for the night curfew, they are pretty much free to do whatever they want there. So over the course of this week, we'll continue to do testing. We'll continue to see where we are. And the plan is for next week to further ease some more of these restrictions if the testing continues to go as it is. So we are more than satisfied that not only are the measures we've taken proportionate, but they have been incredibly successful. And I get the complaints. As I say, most of them come from lawyers. And in case anyone thinks that I have some bias against lawyers, I was once a lawyer. I have a wife that is a lawyer. I have a son that is a lawyer. But, you know, their business is not about saving lives. Their obligations are not to the people of this country. Mine are, those of the governor are, and that of my cabinet colleagues and members of the Legislative Assembly. That's what we were elected to do. So some of them have threatened to take me to court. Let them get on with that if that's what they think is in the overall best interest of Cayman. But I and my government are not going to be deterred from doing what we now know for certain is in the overall best interest of the people of this country.
And let me just add, if I may, on the hard curfews, which perhaps come as much under my sort of remit. I mean, these have been done entirely in line with the police law, and we are a country which follows the rule of law extremely closely, and everything has been done with the advice of the Attorney General and fully in line with the police law. So I don't think we have released the police commissioner's letters to me, but I don't see any reason why we can't do that, and we'll certainly look at that. But we have followed due process and the rule of law absolutely to the letter, including meetings of Cabinet and the National Hazard Management Executive Council when those are required at particular decision points.
I should say, though, that one of the things that we will consider the next time around is the continued necessity of the hard curfew on on Sunday. But we're constantly monitoring how these things are going. We're also looking at the beach and what releases can possibly take place there. Because as we perceive the risks to be lessening, i.e. we're getting more test results and the results are showing what they're showing. Because that's been a big part of the challenge is we're guessing, or not entirely guessing because there aren't sick people, lots of COVID-19 sick people in the hospital and not lots of them queuing up at the emergency. You know, we can draw certain conclusions from that. But given the percentage of asymptomatic people who have COVID-19, and that percentage seems to be higher in Cayman than other places, at least to me anecdotally, we still have to be very careful that we are not fooling ourselves into thinking and lulling ourselves into a sense of security, which will just fall away if we wind up with dozens of cases in 2, 3, 4 weeks' time. That's why we are taking such a measured approach to this.
Okay, thank you for those responses. Will there be a publication of the hard curfew regulations or written details to explain the measures under the hard curfew?
I think the governor's just explained that the hard curfew is not imposed by regulations. It's imposed by an order of the Commissioner of Police, who has acted after consultation with the National Hazard Management Executive and the Cabinet, and with the permission of the governor.
Okay, thank you. My final question is regarding the humanitarian aspect of all of this. We've been hearing from charities on island that they're struggling to keep up with the demand of people in need and the services that are being requested of them. Is government considering perhaps increasing public assistance, expanding assistance beyond the food vouchers and the supplemental assistance provided now to something more substantial?
I'm not sure what you mean by more substantial. The NAU provides a full range of services to thousands of people. It's not just food vouchers. We pay rent. We pay other outgoings. The point is you have to make a case for it, for the assistance to NAU. And many people simply don't want to go through that process.
For example, some of the unemployed who are stuck here and not able to get back to their home countries, I understand that they would be given the assistance through food vouchers, correct? And I'm wondering if that is enough for them given the current situation.
Oh, you're not speaking about local people now, you're talking people who are stuck here. Well, I haven't had...
Well, going beyond, yeah.
Right. I haven't had a report on any new challenges being experienced by the system. They are not being dealt with by NAU, they're being dealt with directly by the ministry. I will ask for a report, but I haven't heard any report of any unusual challenges. Obviously, if people are in need, the government will step in, regardless of whether you're Caymanian or not. As I said before, everybody's got to live, everybody's got to have a roof over their head, and everybody's got to have something to eat. And so we are still committed to doing that if we are aware. I've heard anecdotally that some people are afraid to come and ask for assistance, for the fear that if they do so, government will insist that they leave. And a lot of them are still hoping to be able to resume employment here. Those are anecdotal reports that I have received. I can't say that they are factual, but I've had a number of those. And maybe that is a factor, but I can say to those people, that is absolutely not the case. If when your business, your company resumes business, your employer needs you and wants you back, fine. We know full well that the more people there are here, the more demand there will be for goods and services, and the better shape the local economy will be in. You know, if we completely deplete this this population, it is going to be a bigger struggle for those of us who remain to carry on. So as long as you have a job that you can go back to, we want you to stay. We're not trying to run foreigners away. Our big concern has been the hospitality folk, because it is unlikely in the extreme that there's going to be much to do in the hospitality industry for the next 6-8 months, perhaps. But that is a different matter. But so I just get these anecdotal reports. I don't get to move around as much as I used to anymore because of all of these things. But I do get many messages in the course of a day.
Thank you. I've taken up a lot of time today, so I'll pass the screen over to the next reporter.
Okay, thank you, Kayla. We go to Wendy from CNS.
Thank you, Donna. I have a very quick housekeeping question first, because I keep forgetting to ask it. Airmail, overseas mail, when is it coming back?
Wendy, I'm afraid I can't answer the question. I will inquire again today, but I don't have a report.
Okay, cool. At least I've asked it now, so they can't shout at me anymore. Okay, another question is, you did say this on Friday about the helpers, and I heard it quite clearly, and it was quite categorical. However, given the situation that more people are likely to be going back to work, certainly next week, and we've already had a huge surge of people go back to work this week, the childcare issue is going to become a problem if schools are going to remain closed. So the questions that people have been asking is, what's the situation with the early learning centres? Do we have any kind of timeline for when they might open? And again, at what point nannies or domestic helpers will, where they will actually be allowed to return, if perhaps they can get tested or whatever, if there's some system in place, because it could be quite problematic otherwise.
When I'm told there are 5,000 domestic helpers.
Wow.
So I did float that idea about, could we test them? Well, that's an impossibility. You can test a few, but which means that taking someone back into your house is going to be fairly risky until we have a better idea than I think we do now with 4,300 or whatever number of tests we have now done. If that number were 10,000, I'd be a lot more comfortable, and the results were no different in saying, well, chances are they don't have it. I don't know what the plan is with respect to the early learning centers. I haven't been in any discussions, haven't heard it raised in any discussions that I'm in, but tomorrow we're having an extensive caucus meeting, so I'll get a better idea about where that is. Yes, with people going back to work, it is going to increase the challenges if you go back into the field. I'm hoping that though as many people as possible can still continue and will still continue to work from home, but obviously if you're a construction worker, you can't do that work from home. So I do understand the challenges.
Okay, thank you for that, because it's a big public interest issue. The other one is a bit more broad. Quite a few people have raised the issue about obviously stimulating the economy. And I asked this ages ago when I said about, have you considered borrowing so that you can, expand the public sector a little bit and bring more people in that have perhaps lost jobs in the private sector? Yes. And one of the things that is coming up is government planning. I know you started on the roads. Are you planning on doing the schools projects anytime soon? And is there perhaps even time to review the situation at the dump and start that project perhaps in a different way if things can't go as you'd originally wanted?
Well, I don't know I would hate to throw away what is a 7-year project with respect to the waste management and start over now. I mean, I'll be a real old man when it's done by then. I think that project can proceed. The question about whether government proceeds with others of its major projects is one that we have to talk about. but certainly my view at this stage is that we should continue with as many of them as we possibly can, not only because they are needed, and once we come out of the crisis and population starts to build back, we're going to need that additional infrastructure and resources, but it also will continue to put money into the economy and give more people job opportunities. I do really believe that development and construction is going to take off again at the pace, if not greater than it was before. All the indications we are getting from developers is that they have money in place, and they have staff here, and they want that's why they're pressing so hard to get development and construction restarted, because they don't want their staff to leave, because it's going to be very difficult to get them back. People have to come back. They're going to have to do quarantines. Let alone what may happen to them when they go back to wherever they live. So they are anxious, and the government is keenly conscious of how important it is that we get that restarted. But we're having to balance that desire and that demand against the public health risks, because, as I said to one developer over the weekend, all you need is one sick man on your site, and you're back to square one. In fact, you're worse than square one. The whole site gets shut down. And so we got to be very, very careful and conscious of all of that. But I do believe that development and construction are going to lead the local economy for the next 6-9 months, for sure. And it's key that we get that moving.
Just to be sort of slightly specific, is that a yes to the schools?
Well, the reason I can't say that is because we haven't had that specific discussion with my caucus or cabinet, and I can't take that executive decision here.
Fair enough. No, I appreciate it. And the last one is going to be labelled my stupid or brave question of the day, but somebody's got to ask it. There's a picture circulating of the Speaker at the memorial, so Mr. Estline Ebanks' memorial service at the weekend, where he's not wearing his mask properly, which is obviously a concern. And also, can you clarify what his situation is as far as leave is concerned? Because he is in his full ceremonial regalia. So is he on leave? Is he not on leave? And what do you say about the fact that he wasn't wearing his mask properly?
Well, I haven't seen the photo, and any issues relating to the proper or improper wearing of the mask, you'll have to take up with Mr. Bush himself. I can't comment on those. Mr. Bush took leave from his post, his substantive post as Speaker, following the incident, which has been widely reported. And it's also been widely reported that he has been charged with certain offenses, and that he's appeared before the court, and I think there's another court date coming shortly. But he still holds the substantive post as Speaker. And so merely because you're on leave doesn't mean that you have given up the post. So what I can say is that until that matter or those matters are resolved, he will not resume presiding over meetings of the Legislative Assembly. Obviously, when those matters are resolved, decisions will have to be taken about the way forward. But he is still the substantive Speaker. There is no acting Speaker. The Constitution doesn't provide for that. You have a Deputy Speaker who has just recently been elected. And in the absence of that, as we saw, one of the members of the House is elected to preside over a particular sitting. I hope that's helpful.
Thank you very much. That's all my questions, Donna. Thank you.
Okay, thank you, Wendy. We go now to April from Radio Cayman. April?
Mr. Premier, I just was hoping for a little bit of clarification. I got some correspondence from some of our listeners in the BRAC, and you touched on it earlier, but just the questions came up about whether they were really allowed to freely circulate as they used to. People were having parties. They wanted to know if that was okay. So there just seemed to be a lot of questions about how much freedom there is in the BRAC currently under the new rules.
Well, the shelter-in-place regulations, which obtain and applied broadly across the Cayman Islands, were amended so that most of those do not apply to Cayman Brac and Little Cayman anymore. I would so there is no limit on the except I think the limit is 25 persons together. Is the now size of a gathering, of a public gathering. But I really wouldn't encourage parties at this stage. Hence why we, at the recommendation of the members from the BRAC, the two ministers from the BRAC, we have left in place the night curfew from 8 p.m. to 5 a.m. and why bars remain closed.
So is it safe to say that you are expecting folks to conduct themselves with a reasonable measure of social distancing and following all the other protocols, in spite of the fact that there does not appear to be any widespread instance of COVID-19 in the BRAC?
Yes, with common sense and restraint.
Thank you very much, sir.
Okay, April. We finally go to Ralph at the Caymanian Times. Ralph, please go ahead.
Good afternoon, panel, especially Mr. Premier. I hope you're doing well today. I have a few questions for you, sir. My first question, we went into suppression number 4 about a week ago. How is it going so far with the reopening?
I think it's going very well. I see Dr. Williams Rodriguez smiling with me, so I think he agrees. But I think this week we will really know because of the usual incubation period for the virus, 5 to 7 days. During the course of this week, I think we should be getting a clearer indication of whether that has had a negative effect on the progress. That's the wrong word. Should never use the word progress. On the movement of the transmission of the virus through the community. We are hopeful that it hasn't. As I said, the category of people or employees that were released shouldn't have a great deal. They shouldn't have a great deal of person-to-person contact because their job essentially was to deliver services and products without the need for face-to-face interaction.
So the next stage or next phase should be more challenging to see how the opening up sort of moves on.
Right, and which is why I said that we are thinking that we would not be able to simply release the estimated 8,000 people that are involved in development and construction more broadly, all in one fell swoop. That we will have to stage that over the course of a couple of weeks rather than just flip the switch as we did with the first phase last Monday.
Okay. My second question is one of my favorite topics, money. I was hoping that your finance minister would be able to visit with you one of these days.
I said, Ralph, hate to cut you off, but I did announce last week that the Minister for Finance is coming on this week. Okay. So we're having a caucus meeting tomorrow. We're going to talk about a number of things. It's going to be one of those long ones. We're going to talk about government finances. We're going to talk about the government's proposal to put in place contingency borrowing. We're going to talk about the economy generally and about our projections and plans for how we keep the economy going in the interim while the borders continue to be closed.
I look forward to that meeting. I'll definitely have a few questions. Just two more brief questions before I say goodbye. Frontline staff, do you think businesses should disclose whenever they have positive cases, particularly now that we are moving towards testing frontline staff?
I'm not sure how that is going to help. What I mean is, other than create alarm, that's how I try to assess these things. So if there were not proper protocols put in place, as soon as one is identified, public health moves in, they isolate the individual concerned, they isolate the persons who are known contacts, and then they start the tracing. So, and as we've seen with Kirk's, where there is concern, the whole place is closed down, there's deep cleaning, and then the place is reopened. So I think that we have demonstrated, the government has demonstrated that it takes these things very, very seriously. I think reputable organizations like Kirk's, businesses like Kirk's have demonstrated how much care and concern they have as well about public safety. And everybody has acted, as far as I'm concerned, admirably in respect to the challenges that we've had. So I wouldn't say that the public need to be unduly concerned about how government and businesses are managing these things, but just to protect themselves, as always, in line with the recommendations that Dr. Williams-Rodriguez made today when you go into these places. And you know that you're touching surfaces, avoid touching your face. As soon as you have opportunity to wash your hands properly. Whatever you've bought, if it's in a container, whatever, make sure that you discard the container, that you wash whatever produce there is before you put it up. Those sort of measures will go a long way, I think, to minimize any chance of you contracting the virus as a result of a visit to the supermarket.
Okay, thank you. And you will agree that this pandemic will not go away tomorrow. It will be here for some time. And as we mentioned before, the positive cases will show up from time to time. And maybe that's one reason why you assure the country that, the government is handling these cases with utmost care to make sure that they minimize any serious incidents. One final question, and will we be having these press briefings on a regular basis for the next 2 or 3 months?
I don't know. We've decided we won't have one tomorrow, though. No, the thing is that it is important that we continue to communicate with the public about what is going on and to be as open and as transparent and assuring as we possibly can. But I think we are reaching a stage now that we probably don't need one every day. And so I think this week we're going to aim for Monday, Wednesday, Friday.
Well, that's all for me for today. So until Thursday, that's it, Madonna. Thanks.
Until Thursday.
Hey, thank you very much, Ralph. I do have one final question. This question is for Dr. Williams. Sorry. This question is for Dr. Williams Rodriguez. Dr. Williams Rodriguez, you've mentioned that there are a number of people who've been tested positive that are asymptomatic. What are the chances of persons who don't show any symptoms having other persons around them who may be showing symptoms, but they're not reporting it?
Well, the person who are not showing symptoms, normally it's very unlikely that they can transmit the disease to others, even though we know that this is possible. We have heard that some rumors that there are persons in the same household without or with symptoms without not reporting the same. But once somebody is diagnosis of confirmed to be positive, we will go into the house, our public health will go into the house and will test everyone in the house, regardless if they have symptoms or not. So we will know if anyone else is positive in the household.
Okay, I think further to that question, though, do we believe that there are people in the community who are not reporting that they're having symptoms because they may simply want to be able to go to work or move about, and they're just not reporting that they're sick? They may be having symptoms, but they don't feel like calling the flu line to be told that they have to go into isolation because of. Do we believe that there are people in the community that exist like that?
We don't have any evidence to confirm that there's people in the community with symptoms and not reporting it.
Okay, thank you, Dr. Williams Rodriguez. Okay, final words from our panelists.
Just one shout out and a happy birthday to Miss John McLean at the passport office. Miss Janice McLean, and your staff want to tell you they appreciate you very much from the passport office.
Okay. I'm actually seeing here Wendy may have a final question. So can we go back to her for a moment? Wendy, I'm coming back to you right now. Wendy from
Thank you, Donna.
CNS.
It's just a very quick one, simply because we know that the public are really interested in test numbers. So if we're not having press briefings, which is fine, but will we be able to get the testing results each day, maybe through a press release or through GIS in some way? Because we know that the public really want to know that.
I think the numbers will be posted on the website.
I think they'll get posted on the dashboard,
Yeah.
Wendy.
Okay, so even if you guys don't appear, we can still.
Yeah, well, that's been the
There
case.
will be an updated number tomorrow.
That's been the case for the last couple of weeks.
Okay, great.
Yeah.
Thank you.
Okay, any final words, Your Excellency, Premier McLaughlin? Okay, well, with that, before we go, a reminder from Commissioner of Police, Mr. Derek Byrne, regarding the following curfew restrictions that remain in place until the 15th of May. Please listen carefully if you're not sure. The soft curfew or shelter-in-place regulations on Grand Cayman remains in place between 5 a.m. and 8 p.m. Monday to Saturday. The hard curfew or full lockdown, of course, is for everyone except essential services personnel. That remains in effect here on Grand Cayman, as well as Cayman Brac, as the Premier mentioned earlier, the hours of 8 p.m. and 5 a.m. nightly, Monday to Saturday. You can exercise, of course, up to 90 minutes Monday to Saturday between the hours of 5:15 a.m. and 7 p.m. No exercise is permitted on Sunday, as you should know at this point. Because of the period of hard curfew, this relates to Grand Cayman only, as these restrictions have been removed from the sister islands as it relates to exercise. A full 24-hour hard curfew as it relates to public access to the beach on Grand Cayman remains in place. That's happening through to Friday, the 15th of May, 5 a.m. This means no access to public beaches here on Grand Cayman at any time until that date. This stops any person from entering on, walking, swimming, snorkeling, fishing, or engaging in any type of marine activity on any public beaches here on the Big Island of Grand Cayman. The Commissioner is reminding the public that breach of these curfews carries a penalty of $3,000 and imprisonment for 1 year, or of course, both. Could happen as well. A reminder to go online to gov.ky/coronavirus for any answers to your most pressing questions. Also for guidelines on DVDL renewals. Also, you can go online to eservices.gov.ky to find out about online government services there. Of course, thank you to you, the public, and of course to our panel for joining us. There will not be a press briefing tomorrow, but we invite you to join us back here again on Wednesday. We'll leave you now, for those of you watching via television, with a look at the regional and world coronavirus statistics.